Afternoon. I'm Jeff Flax with Hartford Healthcare. Today's a great honor for us at Hartford Healthcare to help lead a discussion 20 years later, remembering and recognizing September 11th, in learning from those tremendous lessons that occurred as a result now 20 years later. I'm delighted today to first be joined for this discussion with Luis Tavares. Luis Tavares is from the Robert Wood Johnson St. Barnabas system today, health system in New Jersey. But 20 years ago, he was the chief information officer at St. Vincent Catholic Medical Centers in New York, which was the responding hospital and most proximate hospital and the level 1 trauma center for the city of New York on that day. And I, too, was a member of that executive leadership team. And Luis, it's so good to be with you in our presence, and we have this bond that we were together and witnessed one of the most horrific events known to mankind, and at the same time, we were able to see so much goodness and an incredible response and humanistic gestures and generosity as people tried to work through this tragedy.
And we have built this huge bond. I don't know if you remember, but every September 11th, what do you get from me early in the morning?
My first text.
We get a text message in the morning saying we will never forget, right? So we always connect because since then, we have this bond that we have built, that we lived through that together. It was amazing. I cannot believe that it's 20 years ago that we went through that. But what happened that day obviously changed the whole world. It changed our world for sure, but it just changed everything that we've done since, not just professionally, but also personally. So it's great to be here, be able to share memories. Now, there's some memories that I can't really go back and think about because we were talking about earlier that I still can't get myself to go to the museum. I just can't do it yet. Someday I will, but I still can't do it yet.
So traumatic at so many levels. What I remember first was sitting in the boardroom of St. Vincent's Hospital, which is between 6th and 7th Avenue, between 11th and 12th Street, so directly above the World Trade Center. And we heard a noise, and it was an unusual noise, but it was loud, but it sounded like it might have been a mechanical system in our building. And a few minutes later, the door opened, and one of the members of our team came in. And again, I was expecting to hear there was some type of building failure. And he said a small commuter plane hit the top of the Trade Center. I remember he understated, that they didn't think there was a significant number of impact from it. And he would let us know. And then we walked outside shortly thereafter. And at this point, what you could see, there was a fire. And it was more significant. And then we saw the second plane.
Yeah, I was sitting in my office with one of my directors in the hospital there, and we heard the plane come right over us. Really just came right over us. And we had air traffic above the hospital, but not that close. So I mentioned to Bob, something is unusual. This person must be lost. And then like 5 minutes later, the message came in that there was a disaster. I ran out, and I think Sister was already on the corner there, and we can see the plane lodged in the corner. But again, we thought it was an accident, right? And then when we saw that second plane coming around, we thought he was just going to do like surveillance of see what happened. And next thing you know, he went right through that tower. That's when we knew that it was a much, much different situation.
That was the moment.
That was it.
And to me, I do want us to speak about, importantly, the invaluable lessons learned and the changes that have been made and the progress that's occurred. But first, just in that moment, Luis, I have to remark, one of the things that was amazing to see was how people sprung into action and to see the heroic acts. And it came from different people for different reasons, and it wasn't because of the role that they had formerly had within the hospital. It was more a virtue of, I think, people's DNA, their makeup, and how they chose to respond. And what I remember so vividly, first of all, it was such a beautiful day, and we could see so perfectly what occurred. And the plume was coming up, and in moments, 7th Avenue, which would be going downtown, all the cars were coming up 7th Avenue. And you could see and hear around us all the fire engines and police cars and ambulances going in the direction of the Trade Center, and all of the other vehicles, people were emerging at that point and coming at us, and we had closed 7th Avenue, and within moments we had put hundreds of stretchers between 11th and 12th Street, and we converted the avenue to an outside staging kind of triage MASH type unit. And I looked up while that was occurring, and the first patients were now coming up. And I looked on the steps of our trauma center, and you were standing next to our then head of trauma. And I remember vividly saying to the person who was next to me, to Stan, I said, Stan, Luis must have been in Vietnam or had some previous experience as a medic, because you were triaging the patients to within our institution, or in some instances the burn patients were going up to Columbia. And in this image I wanted to show today, because this image is exactly what I was looking at in that moment. And you're in the white shirt with your tie, you're wearing the blue medical gloves. This is on the steps of the triage center. And this is when we were moving people either into the hospital, and in this moment, Luis, we had anticipated that we would be overrun, that we were going to receive thousands and thousands of patients. We're thinking what you experienced and then what happened.
So a lot of things happened while that was going on, which was, yes, we all went out to the front and set up that triage area to receive patients that were coming from everywhere. They were being dropped off in people's personal cars, police cars, anybody. They were just bringing them up to us. The first batch of patients that we received were the patients that were underground that got hit by the jet fuel, the hot jet fuel that came off, and they were in very severe conditions. So we had to get those patients in there quickly. But we had all different kinds of people here, and like you said, we fear they were going to be overwhelmed. So we're getting all the stretchers and moving the patients that are in the hospital so we can create some room, and getting the stretchers out to the front. At some point, we thought we're not going to have enough stretchers. So I put a call in to say, bring us any chair that has wheels on it. So we started bringing chairs with wheels and everything else, because we just didn't know what was happening and the magnitude of what we expected. And the unfortunate thing is that, yes, we received quite a few patients right afterwards. But then later on in the day, things kind of wind down. We weren't getting that many patients. And the reason was because the debris was just so hot that nobody could get to them. So we were already, we had so many people waiting. We had so many people in the city because everybody came together.
It was such an eerie feeling because, we did receive over 300 patients, but they came quickly. And to your point, that people came in so many different forms and fashion. But what we learned shortly thereafter was nobody was coming. And what I also remember, Luis, was shortly after that point where the devastation started to set in, that there may not be any survivors. We started.
I think when we heard, a little later on, when we heard the crumbling of the tower, that's something that I'll never forget, right? To hear the tower come down, we knew that it was going to be really, really big. So, and again, just everybody from the city came together, right? We had so many volunteer doctors that were visiting the city and nurses that we almost got overwhelmed with that, right? We had to take all these volunteers from all over the world, right? Running down to help us.
We were emergency credentialing people
right on the spot,
from outside the country who were
Yeah.
showing us their credentials as surgeons, ophthalmologists. I remember we had to go through the New York Department of Public Health for emergency credentials. It was shortly thereafter that we started getting, the people who were coming up, firefighters.
Mostly first responders,
Chest pain, lacerations, fractures, burns, and a whole series of different types of injuries. And it became, the first responders, I'll never forget the bravery and the courage and the looks in their eyes when they would come back up after doing a run, and the devastation they were describing. It was something no one sees.
Remember what the ambulances looked like when they came back? You didn't even recognize they were ambulances. They were so covered with so much stuff on them. And we had to not only get the patients out, But then we had to throw everything that we could find to put in there just to take it down there, and then wash them because they couldn't see. So we quickly washed them and sent them right back down. I mean, it was incredible the stuff that we did on the fly like that, figure all this stuff out.
A lot of ingenuity. I remember in particular, one of the most indelible things for me, and you were with me during this moment, and there was a gentleman who was brought in, and again, he got there within a few hours of this. It was in the early afternoon, and he had his dog with him, and he came back up, and he was behind the ropes in the triage area, and he looked vacant. He really looked vacant, and it was almost alarmingly so, and he was describing the devastation he saw, but it was in the context of he had been to a series of actual war and battles and recovery efforts around the world, because he was an expert using dogs for search and rescue. And he brought his dog up, and his dog was wounded in this case and had a piece of metal, and we had to actually have people, residents, take the metal out and try to help the dog who had had this experience. And hearing those firsthand accounts in that moment gave an appreciation for the size and scope of this absolutely beyond horrific experience. And I think when you think about the first responders, whether it was civilians, but in many instances doctors, nurses, paramedics, EMTs, and police and fire were beyond heroic. I mean, that's when you saw the healthcare I always described as a team sport. This was the ultimate example of that.
Absolutely. Because not everybody was playing. And nobody cared where you were or where you came from or what you did. We all had to do whatever we had to do to help. And that was the mantra. How can I help? How can I help? That's what everybody said. Right?
So something of this size and scope from a hospital perspective, you can't fully prepare for. And today, 20 years later, the entire emergency preparedness platform has changed tremendously. The lessons that were learned that day were immeasurable. But
think about these lists that I shared with you this morning, which is the communication amongst the hospitals was not there to do coordination. Without communication, you have no coordination. So we didn't have any of that. So we were trying to figure out.
Meaning there was no way. Our hospital was a few blocks away from Beth Israel, which was to the east. There was no way to have a conversation in that moment because all of Lower Manhattan was paralyzed, and there was first of all, there was no power by and large, and there was no cell service at that point. It was overrun.
But remember, for us, it was extra difficult because the number that was being shown on a global basis across the TV was our number. So now people are coming to us from all parts of the city, from everywhere, and we will have to try to give them some information. So we started sharing information via fax machines with all the other hospitals, compiling a list. And then you pulled out an amazing feat, which was to say, let's work out with the new school right nearby. So we set up the center there, which was incredible to be able to do that.
Yeah, I remember when the incident commander at St. Vincent's assigned us the task of going to set up the Family Information Center, which was a brilliant decision at the time by our team at St. Vincent's. And when we went to set that up, it was a sense of solace for people because it at least gave them a place to be, and they waited in line for many hours to get to a table, to talk to a social worker, to talk to a pastoral care associate, to talk to different clinicians or volunteers who were looking at this list. This is that list from that day. Isolated, and what we learned that day very quickly was that when people would tell us that their loved one worked for a certain company, we knew before we even went to look at the list that there were no survivors, and that was one of the most chilling and most difficult experiences to have to tell people that their loved one wasn't in one of our institutions. They were praying they would be in our institution.
Or the other thing was, and again, this was set up really well at that center, was if the loved one was DOA, we took them to a separate area and had somebody there to provide counseling and things like that, because we had a number of those. A lot of them were coming up with these pictures of their loved ones, and I had some of them around here. And the key to that was we had to just take them because we had to make them feel like we were doing something for them. So these pictures that they gave us of their loved ones, we took all these flyers, and I saved a lot of those flyers because it made them feel like somebody was doing something. They were so desperate. Of course, we were all desperate. They were so desperate because it was their loved ones that they were really looking for.
It was incredible, and you remember we created a memorial wall in the coming days as well.
You know, for me, the first day ended at about 12:30 a.m. I said I got to go home and change. I was just exhausted, and I had to take the train back to New Jersey. I used to park at the Blue Cross Blue Shield building in Newark, and that facility across the street was a PATH train, and the PATH train went to the World Trade Center and then went over to where the hospital was. So it was really eerie when I got there about 1:30 in the morning, and the parking lot was almost still full. And I knew that a lot of those people that had those cars were not coming back to get their cars. So it was really eerie to get there at that time in the morning and to see the parking lot full. You know, it's moments like that you can think of us.
Yeah. I stayed at the hospital for several days, and I remember just it became a militarized zone, and
14th Street at the military there.
Below 14th Street, you had to go through a whole series of militarized checkpoints, and we were involved helping establish that, and the sound of the military aircraft flying above us for days, provided a sense of security, but it also gave you a feeling every time that happened that we were at war, and that we were in a war zone. And in this country, certainly we never experienced that quite like that. It's the sounds, the smells, the looks on people's faces, watching the doctors and nurses, seeing the first responders. It was devastating to see, just devastating. You can't prepare for it.
But we have learned a lot. I mean, we have learned a lot. I think the communication system and the coordination system amongst all those hospitals in the major cities is much better as a result of it. And many things that we did on the fly, right, have been made much better, and now been people trained for this. We had no training for handling mass casualty of that.
I think that's the most important point, that in terms of how this tragedy spawned ultimately an entire transformation of emergency preparedness, readiness, alert systems, the redundancies that we have in place today, the ways to preserve electricity, power, communication, supplies. That on September 11th, we brought a helicopter in from upstate New York that landed supplies on the Hudson River for us, and we couldn't give them an order because there was no way to speak. So the police just told them to bring what they thought was necessary. And I'll never forget when that truck came in and the NYPD brought it, we had no idea what we were unloading. Now today we have all of those things pre-ordered, all of those measures are ready to be put in place in a moment's notice. The way information is both shared, the way communication systems, are established and built for emergency situations with special radio channels.
And the level of coordination now, much higher.
The coordination is tremendous, and the drills we do to build temporary hospitals as opposed to use the street. Right today, we have temporary hospital facilities, mobile hospitals that we can stand up immediately. Just it's vast improvements, that were made, but we also drill routinely. And in your capacity as a chief information officer, how do you see today the level of preparedness versus where it was then, and where do you think today the improvements still need to be made?
So the biggest part is that at that time, the best we can do was have a name for a patient. We had no medical history. We had nothing to treat them with, right? So we were, in a sense, flying blind, in a sense, and providing whatever care we could, but also not knowing who is where. So today, we have information network, healthcare information networks, where we can share patient information, right? So whether a patient is at St. Luke's or some other hospital, we can still see that patient's record and know what we did, because the patient may not be able to speak, especially in a situation like that. They're coming in for trauma, right? So much better ability to share relevant patient information to provide the proper care for that patient. Much better end result for the patient when we have that information. The effort that is made on a continuous basis to make that better, right? To create new nomenclatures, new ways of sharing these databases across the systems is so much better. That's the biggest change that I see from a healthcare IT perspective. The fact that we're able to not just garnish the information ourselves, but share with everybody else. And there's still a long way to go. We have to be careful with security of that patient information. It's very critical patient information. So that's hindering a little bit, but I think that's going to get better. And we're going to get to the point where no matter where you are in the country, we'll be able to look at your medical record.
Right. So. And when we act, today, when we activate, all across America, or at every hospital today in America is routinely processed, through the Joint Commission on Accreditation of Healthcare Organizations, which St. Vincent's ended up playing an important role with. We drill, we do mass casualty exercises, we do tabletop exercises, we do active shooter exercises, we do nuclear, chemical, and biologic exercises, and we have systems that are built and tested. And from your perspective, when you kind of assess infrastructure-wise and so forth, where we are today, what's your sense of confidence, that across this country, metropolitan areas and regional cities, because this could happen anywhere, could respond to this type of situation more effectively?
I feel pretty good about where we sit in every major city in this country from an IT perspective, being able to handle something like this and we did a great job without a whole lot of guidance, right? We just kind of made it happen because we had to make it happen. Today, like you said, every major city has a system in place to connect all these hospitals in a case like this. So I think the level of communication and collaboration coordination is much higher than it is, facilitated by the IT environment, because a lot of it is IT based, what we do that. But it's much better. I feel more confident certainly than we did back then, but every year is getting better and better. People are making the investments too in the IT systems to make this happen, which was a major point.
Luis, I'm so grateful for you joining us today. When I think about healthcare heroes, that day the heroes were countless. People did what they could. They did everything they could. The generosity of people wanting to donate blood, the generosity of people, who were bringing peanut butter sandwiches and bananas and bottles of water, the number of people who were volunteering to be emergency credentialed. We saw everything, but in particular, the police and fire, our dependency on them, how honored we are for their service. The ambulance personnel were extraordinary, and the doctors and nurses and people to support them. But you inspired me in that moment, I remember just very clearly thinking to myself, wow, Louis, you stepped up and just did what was needed in that moment, and you helped so many people, and you continue to keep kind of the flame alive on remembering and honoring all the people who were lost, remembering and recognizing all the people who came for service that day, and ensuring that we learned from it.
And it's helpful for me to share this because it's difficult to think about it sometimes, and to not get choked up about what we went through.
It was an incredible experience. I always said it was one of the great honors and blessings, was in many ways the good fortune to be proximate so that we could do something. All right, we could do something, and doing anything felt like at least we were contributing. But compared to what the frontline people did that day, that's who did it, and that's who responded, and that's when I think it forever changed our recognition, appreciation for the nature of how people work together. So I really thank you.
Thank you.
Thank you so much.
Yeah, thank you.
Next I would like to bring Dr. Frank Aluzzi forward. And Dr. Frank Aluzzi is one of our senior emergency department physicians here within Hartford Healthcare. And Dr. Frank Aluzzi bases out of our Fairfield region. But on that day, Dr. Aluzzi, you were in Queens. You were at Long Island Jewish Medical Center, a very, very substantial and very significant hospital in the metro New York area. And you were a chief resident in emergency medicine. And in emergency medicine, responding, this is what you do. This is what you're built to do. It's what you're trained to do. It's your mission and your purpose to be there for what you can't fully anticipate. But this was different. And maybe if you could just describe in that moment on September 11th where you were and what occurred.
Sure. Well, thank you for having me, and it is an honor to be here to remember September 11th. That day was a Tuesday, and it was a gorgeous Tuesday. I remember driving into the hospital, and it's 10 miles as the crow flies to the towers, and I remember pulling into the parking lot and seeing the towers, and it was just a stunningly beautiful day. And walking into the ER for my 7 o'clock shift, it was just an ordinary Tuesday, and I was on shift. I was actually in the radiology suite looking at a patient film, and somebody came into the radiology suite, knocked on the door, and said, "Hey, a plane just hit the tower." And I said, "What tower?" "In the World Trade Center." I thought to myself, how is that possible? Because it was so clear and so still, it didn't register, how that could, happen. So we turned on the television, I looked at it, and like you said, the initial reports were it was a small commuter plane that hit, but the building was on fire, and you know that there are tens of thousands of people that work in each of those buildings. So, we called the disaster code, we called our disaster, we set up our incident command. At the time, we talked about communications. Communications with Incident Command was a radio. It was about this big. We used to call it the brick because it weighed like a brick and it looked like a brick. And we set up the Incident Command, and we discussed with FDNY at the scene, and they again said that there were a number of initial casualties, as you spoke, from the kerosene coming down from the planes, and they were at St. Vincent's, but they needed to set up a triage center in order to better disperse any of the casualties throughout the system. And so they asked each of the receiving hospitals around the city, which we were one, to anticipate getting somewhere around 500 casualties, and they would figure out logistics on how they would get them to each of the different hospitals. And as we were talking about the logistics, that's when the second plane hit. And I remember hearing, what had happened and seeing what had happened. They said, okay, whatever we just told you, double it and, get ready because there's going to be, now we have twice the problem on our hands. Within 15 or 20 minutes of that second plane hitting, we had about 100 to 150 doctors and nurses descend on the emergency department, much to your experience. Everybody just showed up, rolled up their sleeves, and how can we help? In what way can we help? So we had plenty of people that we were just arranging. We were figuring out how we were going to triage people, how we were going to take care of the people, how we were going to set up OR time. And, when the building then collapsed, we were talking about getting people, into the city to help out because, perhaps they weren't going to be able to get patients in. And communications was very, very difficult that day. You mentioned just talking amongst the hospitals and talking among Incident Command. When they set up the Incident Command at the base of the tower, and when it collapsed, we lost all communication. We were flying blind for much of the late morning and early afternoon thereafter because it never got reestablished again. So it was a very kind of chaotic, preparatory, anticipation, trying to see how we can help. And then you start mentioning, later on in the afternoon, we had a trickle of patients. We didn't see several hundred like you guys did. We saw a couple dozen patients, and those are patients who made it to our hospital on their own. They were covered in the soot. We had no way of decontaminating them. We had to clean them off, and then by early afternoon, we realized we weren't getting anybody else, and it was just so deflating. We wanted to help in every way we could, and just the fact that we weren't getting casualties that we could help, it was very deflating for the staff, and that's really what I remember from that day.
Incredibly deflating. A few thoughts you triggered in my head. One was first the importance of Incident Command. The then president of St. Vincent's Hospital, she sat as our incident commander for probably 2 days without taking a break, and she was remarkable and really commanded and directed our activity. All of the leadership of the St. Vincent's team rallied around doing what was necessary, and it really was a learning process because we weren't as trained and prepared as we were today, but we did what was necessary. And when you think about your role now, in your career, leading emergency department medicine, urgent and emergent related care, how far, in your opinion, has it come so that in our communities today, if there were to be a mass casualty event, God forbid, that the systems work differently, than they were then, when we really were out of contact in different ways, discoordinated. And even though we had incredible leadership, much of it was being done kind of as necessary as needed.
Yes. There was a lot of heroic work that day, and there's a lot of heroic improvisation that was done at that time. We had our disaster protocols, but nothing on the scope of that was. And it really exceeded anything that we had in our disaster plans right there. And so after 9/11, there was a whole body of work. There was a lot of introspection. There's a lot of review of what was done that day, what worked and what didn't, and what needed to be built in order to prepare us for mass casualty.
So be a little
events later
specific
on
those types of things.
Well, sure. One of the things that came out of it, I mentioned the dust. There was no way of decontaminating patients, and then, around that time we also had the anthrax scares as well. We had to kind of retrofit our emergency departments to build structures that are capable of extending outside of the ER borders, so you're not on 11th and 12th Street setting up MASH units. Right. That you actually have an area where you can put a pop-up tent up, where you can have an area of decontamination where if people are coming in contaminated, whether it's with the white dust material or whether it's a biologic or a radioactive, that there's a way of keeping that away from the emergency department so you're not paralyzing your emergency department. Right. Having an ability to flex up and have surge capacity. You're not always going to have the luxury of having 100 people descend on your emergency department in a time of need. We're noticing that, with our response to COVID this year, it's very helpful to have a list of people that you can then reach out to when you have surges, and you can plan it so you don't have 100 people coming out all at once, that you know that you're going to have stages of shifts that you're going to have to come in so you're not burning through your staff. Having a plan of how to ramp up your operations and then ramp back down and kind of reallocate, like you need a communication center, having those things written down and what your contingency plans are, that's all written down.
Correct.
And the emergencies that have happened since 9/11, you can tick through them. I have friends up in Boston for the Boston Marathon bombing. A lot of the lessons we learned at 9/11 saved lives during that episode. There was a lot of communication amongst the first responders and all the area hospitals, and it really was that you had serious injuries during that bombing that made it to the hospital. If you made it to the hospital, you largely survived. Right. And it was just a tremendous success story, and it was born out of the tragedy of 9/11.
It's interesting. In many ways, I bookend my career with 9/11 and more recently the crisis with COVID-19, and so much of the way we've been able to respond to COVID-19 is a result of the learnings of what occurred on 9/11. Sure. And you could really see it around inter-hospital coordination, capacity planning, communication, the ability to change scale, the ability to deploy things like decontamination, the integration with first responders. It's all standard work today, and we leveraged it throughout this crisis and continue to do to protect the safety of the community. And when you think about this tragedy, and for all people in our country, it's a day of unbelievable loss and sadness, and something that I'm not sure anyone who was alive in that moment fully recovers from. But at the same point in healthcare, we learned a lot and need to continue to move forward, because even within this pandemic, right, there's so many learnings today, and I've described it as, we have to be better. Mm-hmm. We're not trying to go back to normal in healthcare, because normal pre-COVID wasn't good enough. And I think in this case, particularly the issues around health equity, where there's glaring mandates, for us to make improvements, where we've made many, but there's so much more to be done. Do you feel, as you look back today, and particularly looking at it through the lens of emergency medicine, emergency preparedness, are there things you feel like are the what's next, what we have to do differently and better today?
With respect to our response to COVID, I do see parallels, because I remember at 9/11, looking at the scenes, looking at what you went through downtown, looking at the scenes you saw on the television, we kind of got caught with our pants down. COVID, we did too. We haven't invested nearly much in public health in terms of surveillance. If you remember back to last year, this virus was circulating around months before we knew. We didn't have the adequate testing in order to find it, and even the response was slow. And it seemed like the response was always a couple weeks behind the virus. And just like, I was talking with a colleague yesterday, 9/11, that day just kept getting worse and worse and worse. It seemed like every half hour another shoe was dropping. With COVID, it really reminded me that last year, that every month it's kept getting worse and worse and worse. And just when you think you're out of the woods, it goes back again. And we really have to, I think, redouble our efforts in terms of public health measures, surveillance measures, and identifying again the social determinants of health. The health equality. This COVID really adversely affected our most marginalized populations. We need to address the public health and the population health issues of our day. So I think that's the lesson that I would take from this.
I would agree with everything you said, but I would add another important parallel. What we saw in Lower Manhattan immediately after 9/11 and throughout, the region for months and really more than a year later was the impact from a behavioral health perspective and the post-traumatic stress and the inability for people to, obviously, we were all mourning in different ways. People were affected at so many different levels. Many of us lost friends and colleagues in that experience. And how do you recover from it? It's behavioral health professionals helped people tremendously, and we're seeing that today also. And we have to invest and be more focused in that, in terms of our capacity to support people. And I'm proud of what our system is doing, but again, we're going to do more, in that regard. And that is, to me, one of the really important lessons I learned in New York was, the event itself, you could argue was a date, 2 days. The event was years.
Yeah. For anybody who was practicing in New York after 9/11, and we had Hillside Hospital at LIJ, so that was the regional Queens and Nassau, receiving hospital for behavioral health. We were seeing many of our first responders lived in Queens and Brooklyn and Nassau, and so we were seeing, first responders who were working on the pile afterwards and had lost half of their units and family members or both parents, and so we were dealing with this endless trickle of, and it wasn't even a trickle, it was this endless stream of people who, like you said, they were vacant, they were distant, they had PTSD, depression, a lot of behavioral health issues, and that exacerbates any other, somatic problems that they would have, and you would have dual diagnosis, exacerbations, so you'd have exacerbations of chronic disease with their exacerbations in their mental health, and it was a very, it went on for months and months and months and years afterwards. This wasn't a single event in terms of behavioral health, to your point.
Absolutely, Frank. I really thank you for joining us today, for your service, for what you do to help us continue to be as prepared as we possibly can be, and continue to learn, as we go forward and adapt. I thought it was critical today, in remembrance of September 11th, to help lead the discussion, to help be transparent, to be introspective, and to continue to try to learn from these events, remember and respect the memories of so many lives lost, so many people impacted, to recognize the service and contributions of our police and fire, our ambulance, all of our medical personnel, including our nurses and our doctors, and everyone who served, and to work to take advantage of our continued focus and efforts around emergency preparedness. It's an essential role of an institution. I learned that day, more probably than anything, was the centrality of a hospital in an emergency situation like this. The hospital became the epicenter to the community after the tragedy occurred, and all people who work within the hospitals, and I'm very proud of the work done in Connecticut, but certainly across the country, is to ensure that we stand ready, that we're prepared, that we're anticipating what could be, and that we have the right systems and structures to be able to respond in that moment for our community. It's our mission. It's really in many ways why we exist, and it's why in so many ways September 11th is so poignant for everybody, and certainly particularly for those people most impacted. So thank you very much for joining us today. Thank you, Luis Tavares. Thank you, Frank.
Thank you.
And we're going to continue to keep this conversation alive and moving forward, helping us get better at getting better.